Hello again. Today I'm here with Dr. Key and we are talking about cupping. Cupping is quite common. I know lots of people are aware of this, but we're going to find out a little bit more, have a deeper explanation, and we also have some very interesting looking cupping tools that I've never seen before. So, Dr. Key, please tell us, what is cupping?
Well, cupping, in fact, it is one of the very common used methods all over the world, not only in Chinese. Even I know Russian, ancient Russian do it, many European, some Eastern European countries do it, or even some Indian do it. So basically, they are using some cups to put on the body and then create some kind of vacuum to stuck on the body, stick on the body, and sucking. So, for example, let me show you here.
Oh yes, I love these.
You know, in ancient time, Chinese used bamboo. This is a bamboo.
Wow.
Okay,
So
it's just the bamboo. You can see the bamboo, and we cut bamboo. So this is it's like a bow. So you light some fires. That's like a paper and put throw into it, and then immediately you stuck on the skin, and then the fire will stop immediately inside. It will not burn you.
Right.
And then they started this vacuum.
Okay.
And they start stuck in the skin cupping. You can using teapot, the tea cups can do it. Yeah, if you don't have to be using special cup. Tea cups or even bottle. Nowadays we use these cups which is made from glass. So the glass is much more because it's easy to see inside and easy to clean. So people use this more often now, and this is most popular. This is a cupping for also would light the fire here, and then you put on skin. So stuck. But finally nowadays we even make into a so-called without using fire, using sort of like a vacuum little thing to sucking out air, not just draw out air. So people, you like for your hand, you put a hand, and then you put it here, and you start sucking air, and you can see that they're stuck there. So this is cupping. So you not put it out, just put let it. You can see immediately red. So the cups changes, and also of course they have different size. Some are huge, some small, depends on the area you want to cupping. Now this is a very universal, quite common now. But the Chinese cupping, they are special is because they follow the meridian theory. So basically the cup, as you know, they make skin completely red straight away. So they can make skin red, make blood flowing, and actually they're sucking out. So in fact, in many illness, we believe if there's toxin in some area, we suck it out quickly, and that will be good. For example, and I remember if something bites you, let's say a mosquito or snake or insect bites you immediately, if you can suck out the bad blood, so it will not cause bad infection or bad reactions. So that's one way. But nowadays we're using more than that. It's a more for we believe that internally there's problems such as like dampness and cold, or even congealed blood or blood stasis. Those conditions, if we use cups to suck them out, this what called bad things in the body, it will help the body to recover. Now there's very common. You see even in the Olympic game, you see some athletic people, some people, under the back have lots of mark and a red mark. Sometimes they give joke, they call it love bite. It's not love bite. It's just simply the cupping. So make the mark. So basically, when people have a little injury, say for example, if I'm a swimmer, I got an injury in my shoulder or my back muscles, very painful. So therefore, we put some cupping there to suck out this bad blood, so make flowing better, and then they will heal much quicker.
How exactly do the toxins get released? Because you're not pulling blood out, so are you just taking them to the surface of the skin, or how does that actually work?
There's two ways. Number one, it does. It does just putting the blood out to the surface. That's one thing.
But it doesn't come out of the skin, it just comes to the top of it. Do you mean that?
Well, you see, you have to understand, each skin completely isolated. Completely like glass or sealed from body. No, there's many holes from the skin. Okay, that's why there are many medicine. Even Western doctor using like steroids patch put on skin, and the steroids can get into the body.
Yes.
So therefore, the skin, in fact, there are many holes.
So it can also get out, things can get in.
Yeah, if you can get it in, once we can get out.
Okay,
Both ways. There's no way it's like one-way traffic. So we say it's good for cold condition, for the blockage condition. but not good for the heat condition. If somebody still have a lot of like eczema, have this all skin become red, itching, that's not good for the cupping because the cupping more heated.
Right.
Two is that depends on where you cup. Okay, it's not everywhere good for cupping. Some area is good, some area not very good. So that also depends on how this what we call acupuncture or the body meridian distributions.
Okay.
Okay, we follow meridians. That's another important thing.
Can you cup just on the back, or can you do cupping on other places of the body?
It's not every condition are suitable for using cupping.
Yeah.
You must understand that. So there's always a limit of sort of conditions. That's why I said this is only one of the many methods
Yes.
Chinese medicine applied. So basically, it's what we call for the cold, for the damp, for the stagnant conditions. Obviously, we need to explain what is cold and damp, but basically it's for blockage.
Sure.
But opposite, for example, for the heat condition, and that's not too good. For dry condition, not very good. Okay, so if somebody heat, for example, have eczema or you have a bad skin infections, they're already red and swollen.
Yeah.
You come to make them more red, more infected. That's not very good. Another thing is where you are cupping, as you said.
Yes.
So we are normally follow the meridians. Okay, so it's not like say, oh, you have headaches, let's cup your head. Where do you put a hard hand? So you say you have eyes pain, put in your eyes. No, not your eyes will be bulky. That's terrible. That's not good. We can't do that.
Yeah.
So that's why if you have eye problem or headaches or cold, so we put meridians according to where your headaches are.
Yeah.
So for example, we have this liver meridians, we have a gallbladder meridian, we have bladder meridians, stomach meridians. So it depends on which meridians have a problem and the pain, and we cup in sort of accordingly.
What skill is involved for the doctor in order to do cupping effectively?
Yeah, sure. That's why we need to train people. Number one, anything you do, first of all, you must be no harming.
Yes.
So therefore, we make sure people choose the right place, do the right technique. And in fact, there's another cupping which Chinese call the moving cups. So what happens is when you put a cup in, let's say put it here, and actually you can move the cup slowly to here. Let's say if you put the cups here, and then you can just gently move around the meridians, just like you do the massage, a trainer plus cupping.
Wow.
So they are very effective too.
Yeah.
A little different from ancient like Russian or other African people cupping, because we have all applied all this meridian theory and the medicine theory together.
So it sounds to me like if you're someone who thinks they want to get cupping, they should come to a Chinese doctor and see what the doctor says, see if they advise it. Like, you can't just come in and say, I want cupping, because there's a few conditions to see if it's actually the best thing for you.
Here's what I always tell patients. I said, please don't tell me what I do for you. So what I tell you what should do for you.
Yeah, fine.
What is good for you.
Yeah.
So people come to me and say, should I have a needles? Should I have a herbs? Or should I have a cupping or massage or other things? I say, okay, you leave that to me.
Yeah.
Because you come to me first.
Yeah.
Let me know you. Let me check you. So find out what condition you have and also what constitution you are.
Yes.
So in other words, are you, in Chinese term, hot or cold? Or are you damp or dry? Or whatever. There are many, many different terms.
Yeah.
So when we establish that sort of diagnosis, if you call it, or this decision, and then the treatment will follow. So if you're hot, we did the cooling things, not cupping.
Yeah.
If you're opposite cold, we do the opposite, we warm you. So that's the how we body,
Yes.
the harmony, the neutral, the middle is the most important.
That's right, and that is the approach. That is the difference. So when you go into a Chinese medicine to see a Chinese medicine doctor, you have to kind of bring yourself. They look at all of you, and from there you advise the treatments, as opposed to booking in for like a Swedish massage or cupping or like a treatment that's just like a standalone treatment.
Oh yeah.
It's like you decide what's the best, even the best way to get to the problem. When you have a lot of methods to choose from.
Absolutely. Rather than universal kind of standard.
Exactly.
That's
right.
no. If your clinic offer you universally, massage or cupping, I think that's not, in my opinion, the real sort of authentic Chinese medicine. Or at least it's not correctly applied.
Well, I think your extension, that idea is brilliant. Yeah, thank you for telling us really the essence of what it is, what it involves, and why it's effective for certain people in certain times.
Yeah, just give some idea. It's always good to know before you do something, not follow the fashion.
Yes, agreed. So thank you. There we have Dr. Key again on cupping. Very insightful, and I absolutely loved all these different ones. There's so many different things I didn't know existed. So was this actually before the invention of glass, do you think?
Yeah.
That is amazing.
Because glass is not, is not ancient things.
Yeah.
Although they are made quite a long time, but making glass is very expensive in ancient times.
Yes.
So the bamboo is easy.
And I love that you can also use it with your teacups. That's just
using
so
teacup.
amazing.
That's why sometimes when we travel as a doctor, sometimes we go someplace, some people injured, we need a cupping, and not say, oh, please go get London, get a cup. No. I say, do you have a teacup? Or do you have a bottle?
So brilliant.
Use them immediately. You don't need anything fancy.
Yeah.
Just normal things.
Well, thank you again, Dr. Key. Well done.
You're welcome.